So today, I want to talk about sleep and anxiety. I remember when I visited some hospitals in China, I talked to some of my colleagues in the field of psychology and psychiatry. What they told me is a lot of doctors in China, when they treat insomnia, they often tell patients, well, you have insomnia must because you are either depressed or anxious. So let's put aside insomnia and just treat your anxiety or other mental disorders first. If you feel better, your sleep problem gonna be gone. Well, I disagree with this opinion, because sleep and anxiety or depression not always overlap. Let's focus on anxiety today. So I think when we cannot sleep well, there are two types of anxiety. One is the anxiety about sleep itself. The other is anxiety about day-to-day, like life, work, and stress. So we basically carry these two types of anxiety on our shoulders, and that can lead to a lot of sleep problems and insomnia. For example, you cannot fall asleep easily. You cannot shut off your brain at night. One research published in 2003, they try to investigate anxiety and insomnia, which happen first. What they find is those people who have insomnia first happen among 18% of the case they studied. On the other hand, those who have anxiety first and then later developed insomnia is about 43.5%. The rest are people have both at the same time. So based on my own clinical observation, along with all this research data, I think, you don't have to have anxiety about life or work, but you still could have insomnia and you still could have sleep anxiety, very specific. Also, I think sleep anxiety do impact how severe you experience the insomnia symptoms and how long you're going to suffer from insomnia. I think sleep anxiety is the key factor to make your short-term insomnia become a chronic insomnia. So that's why when we use CBT for insomnia, this method to treat insomnia, a very big piece is to target our cognitive component to help us reduce sleep-related anxiety. I have some patients start worrying about next night's sleep since the morning, right? Can you imagine the whole day they are worrying about sleep? So what are some signals you really should watch out? I want to mention 4 of them here. So first, when you're trying to sleep at night, you just cannot shut off your brain. You have so many worries coming through your head. All these worries just keep you awake. Second, during the daytime or when you're approaching bedtime, you start worry about sleep. For example, what if I sleep poorly? What if I sleep poorly today again, since I haven't slept well for the past several days? If I sleep poorly today, what that can do to my health? Will I have problems at work or at my focus tomorrow? All this are worries actually make the sleep even more difficult to happen. 3, in the middle of the night, you sometimes wake up suddenly and you just cannot fall back asleep. I have some patients with anxiety, mostly have general anxiety, and they somehow, their brain and body just wake them up in the middle of the night for no reason. They just feel like this heart is pounding really fast. They have some physical symptoms upon wakening in the middle of the night. I think that's a signal that your sympathetic system works really hard. It's super alert and it's too active, so it wakes you up in the middle of the night, even when you are asleep. 4, your body tells you something. So you have reactions in your body. For example, muscle tightness, you don't know how to relax your body. And even whatever meditation you try, especially when you think about sleep or approach bedtime, you just cannot seem to relax your body or start having some pain or uncomfortable feelings in your belly and in your head, in your chest, somewhere in your body. So body always tell us something. So after knowing all this, if you think you have anxiety and that your anxiety interfere with your sleep, what are some things you can do? So I want to give you 3 suggestions you can consider. So first, start with your body, as I just mentioned. I want you to really pay attention to what your body needs for sleep and try some muscle relaxation exercise to really help you learn how to tightening your muscle and how to relax your muscle. That can really help you relax your body. And when your body is relaxed, it will send a signal to your brain and help your nerve system to calm down. But if you have too much sleep anxiety, I want to warn you that if you try to relax just before sleep, and in order to use relaxation skills to help you fall asleep, you may fail. That does not mean the relaxation skill does not work for you. It just the purpose is too strong. You are using these relaxation skills to control your sleep. Then, of course, it won't work. If you find yourself have too strong sleep anxiety and meditation or relaxation before bedtime does not help, then I would encourage you to try to practice this at daytime when you don't have sleep pressure. You want practice and be familiar with all this relaxation exercise when you don't feel the pressure to go to bed. That way you can really feel how this exercise help your mind, help your body to relax. After you practice that for a while during the daytime, then you can apply that to nighttime. Or second tip, well, try to really set up some wind down time before bedtime. You know, if you have sleep anxiety or you have general anxiety at work, at life, you possibly need a longer wind down because your brain is far more active than others. So try to set up maybe 1 hour or even more before bedtime to really engage in some enjoyable and fun activities. The third tip, I think is the most important, is to try to shift your mindset about sleep. When we treat insomnia, I always tell people, you know, sleep should happen naturally. You should not force it to happen, and you cannot force it to happen. The more you try to control it, the less likely it's going to happen. So you have to practice and use some psychological skills to learn how to let go of the control, how to learn the science behind sleep, to understand how sleep actually happens in your body in a natural way. The more you learn about the real science behind sleep, I will guarantee you, the less worried you're gonna get about sleep. A lot of time, our sleep anxiety or our worries about sleep comes from some misperceptions of sleep. So we kind of think of sleep or how good sleep should look like in a way that actually is not correct. But we are focusing on that and we are trying to force it to happen. Of course, you are on the wrong path, right? You try really hard, but the direction you are going will not lead you to a good night of sleep. So learn sleep knowledge from sleep professionals and slowly adjust your mindset and to accept that you may have bad night of sleep and you may have good night of sleep. And if you sleep poorly someday, that's okay. It won't kill you. And a lot of times, you think you sleep poorly, it's actually not as bad as you imagined. You may not even know you are sleeping. You think you are awake, but actually you possibly are at some light stage of sleep. You can never be sure. So don't trust yourself. Don't trust your own assumption that much. So at the end, I want to emphasize again, if you have sleep problem, especially insomnia, the best evidence-based treatment worldwide right now is cognitive behavioral therapy for insomnia, CBTI. Clinically, I witnessed how many patients really recover fully using this method. It's much more powerful than sleep medication. So I encourage those who are struggling with insomnia to consider this treatment. Find local professionals to really help you through it. I also have CBTI online course, and I provide weekly Q&A. I have one CBTI course in Chinese, one in English. If you want to consider it, you can find the link down below at mindbodygarden.com/course. Well, thank you for listening and watching today. I'm Dr. Yishan. If you have any questions about sleep health or insomnia, please feel free to leave me a message. Let me know. I will see you next time. Bye.